I'm Dr. Alla Gopala Krishna Gokhale, cardiothoracic, transplant and minimal access surgeon. In the next few minutes, I'm going to explain about heart valve surgeries. We all know heart is very important for us. Heart pumps about 5 liters of blood supply to all the organs in the body so that all organs can work very well. Sometimes heart can also get affected with various problems. It can get a heart attack. Sometimes it can have fluid around the heart compressing it. Sometimes there are valves inside the heart that make sure blood is going in the right direction. These valves can get damaged. These are called heart valve problems. Whenever a problem happens to the heart will not be able to supply blood to all the organs in the body, and patient can get various problems. For example, if there is a heart valve problem, people can have breathing difficulty. Previously, they have been walking for some distance. Now, when they walk that much distance or even less, they get short of breath. Then they have to take some rest. Sometimes they develop swelling of the feet because heart fails, fluid pulls up in the legs, then they will have swelling of the feet. Sometimes heart has to work much faster than otherwise to give blood supply to the heart. Then they can have palpitation. That means they feel the heart beating inside. So these are some of the symptoms. When people get these symptoms, they come to the doctor, cardiologist. We do some tests, ECG, and then echo. Echo means it's an ultrasound test of the heart. Many a time when we tell the patient that they have heart problems, they ask us what are these valves and explain us about the problems. Heart is like this. See, it has got 4 chambers inside the heart. There are 2 chambers on the right side, one on the top, one on the bottom, and another on the left side above and below. See, impure blood goes from all the veins from here to the right side. From here, it goes to the pumping chamber here through a valve. Here, there is a door-like structure. When this is pumping, this door will close and this valve will open here. The right side second valve, blood will go to the lungs. And from there, after oxygenation, blood comes to the left side. It comes here to the left upper chamber. And from here, it goes to the lower chamber through this valve. This is called mitral valve. And when this lower chamber called left ventricle is pumping blood into this big pipe that takes blood to the body, this valve has to close and this valve has to open. This is called aortic valve. So what these valves they do is they make sure that blood goes in only one direction to keep the efficiency of the heart. There are 2 valves on the left side. There is a mitral valve, aortic valve, and on the right side there is one tricuspid valve here, pulmonary valve. Of these 4 valves, generally the mitral valve and aortic valves, they get a lot of problems compared to the right side. These valves can get damaged due to various reasons. Sometimes they can get narrowed, thereby the blood from the chamber above cannot come down, or sometimes these valves start leaking. For example, blood is coming from above here. This is pumping. Blood should go out like this. Sometimes the blood leaks back through this valve. It is called incompetence. Whenever valve gets narrowed or valve starts leaking, then people start having problems. If it is the leak or block is severe, then they need some treatment, sometimes in the form of medicines or sometimes in the form of surgery need to be done. Once after investigations, we decide that the patient is having a severe problem, we take them up surgery. It is called open heart surgery. We have to stop the heart, use an artificial heart-lung machine, then we open the heart, go to the valve where it is damaged, then we try to repair initially. Some of the valves can be repaired because the best valve, of course, is the nature-given valve. What all artificial valves we have are not the best still. So we try to repair the valve. If it is not possible to repair, then we take the valve out and replace with an artificial valve. There are 2 types of artificial valves. One is mechanical valves. That means they are metal valves. If you put that metal valve, people need to take blood thinning agents lifelong. They cannot take green leafy vegetables. Whenever they develop some infection, they need to go to the doctor and take antibiotics much early. And suppose they have to go for some surgery, because they are taking blood thinning agents, they can bleed. So they need to inform the doctor that they are taking these blood thinning agents. So a lot of precautions need to be taken. We generally use these mechanical valves in people less than 45 to 50 years of age. These valves can work for 20 years, 30 years, 40 years, provided the patient takes these blood thinning agents and avoids green leafy vegetables, goes for regular checkups, and does some blood tests called INR. That means when we do this test, we know whether the dose of the blood thinning agent is right or not. We need to keep this INR 2.5 to 3.5. If the INR is more than 3.5, then these people can have spontaneous bleeding into the brain or into the urine, so they have to be very careful. If it is less than 2.5, valve can get stuck. So we have to manage this INR in the narrow range of 2.5 to 3.5 by doing this test once in 2 to 3 months. Your doctor will adjust what dose you have to take. Now the other type of valves we have are called tissue valves. That means these are the valves taken either from a pig or from a cow pericardium. Pericardium is the cover that is around the heart. So from the pericardium of the cow, these artificial valves are made. We usually put these tissue valves over the age of 50 to 55 years. The advantage of the tissue valves is after about 2 to 3 months of taking blood thinning agents, they don't have to take most of the times any blood thinning agents. They can be like any other normal person. They can eat everything and they can go to the doctor once in a year to make sure the valve is working very well. But this other side of this is these valves generally work for about 10 to 15 years only. After 10 to 15 years, they may have to go back for one more operation to have one more valve. So based on the longevity of the patient, suppose a person is about 40 years, 30 years, then they can generally live for another 30, 40 years. We try to use mechanical valves to avoid second operation. But someone is past 50 years, they cannot take blood thinning agents, they often forget to take medicines. Some such people, we usually choose the tissue valves. Whatever valve we put in, we generally explain to you whether you have to take blood thinning agents, what are your dietary restrictions. As I said, for mechanical valves, people cannot eat green leafy vegetables. It contains vitamin K. Whereas for tissue valves, they can eat everything. So after this operation, after the surgery, it takes about 3 to 4 hours. People come to the ICU. For a long time, we have been doing these operations through a incision on the front of the chest, cutting the breastbone about 15 to 20 centimeters in length. But these days, we are able to do most of these patients without cutting the breastbone through a small incision on the right side of the chest, about 6 to 7 centimeters. This way, people have a small scar and then they recover much faster. We don't have to cut the bone, less bleeding, less infections, less complications, and the scar is covered in the breast. There is a lot of advantage with this minimal access surgery. Whatever type of operation we choose, we'll let you know before the surgery itself. After the operation, we bring you to the ICU, keep you there for about 2 to 3 days. It takes about 6 to 7 hours by the time they come out of anesthesia. And once they come out of anesthesia, there are no complications like bleeding, heart is working well. We remove the ventilator, then the patient will be able to talk to the attendants. After 2 days of stay in the ICU, we shift them to the ward. They stay there for about 3 to 4 days. During that time, patient needs to do a lot of physiotherapy. Physiotherapist will come and explain what are the exercises to do, and the dietitian will come and tell what are the types of diet patient can take, what are the diets people have to avoid. For example, as I said before, if the mechanical valve is put into the patient, they need to avoid green leafy vegetables lifelong. Otherwise, whatever blood thinning agents we are giving, they will not work. Whereas for tissue valves, after about 2 to 3 months, they can take the normal diet. So once we explain these precautions and we discharge the patient with prescription, what medicines to take, and what are the emergencies that can happen, and when they come, which is the phone number they have to call for appointment. But these people, they have to remember that this is not a curative operation. If suppose we replace the valve, these valves can work only for some time, not like a natural valves. They need to come to the doctor for regular checkup, get all the tests done, then these valves can work very long time. Mechanical valves can work for 20, 30, 40 years. Tissue valves generally work for 10 to 15 years. Based on the progress of the patient, we keep some medicines. After some time, we take care of the medicines. Most of these patients do really well for a very long time.